Friends, I'm going to share with you a very important case. We will now go into practice through this case number 1, and which I am going to take in detail. We will be discussing about how this patient travels from one physician to another physician to various processes, from a primary care physician to emergency physician to neurologist, and how everyone defines the problem, and finally when she comes to us as homeopath, how we will look at this case little differently, how we will look at this case totally in holistic perspective, thanks to this patient who has allowed us to share her journey with us. So we will see in this case that she is presenting to us with various complaints, and before that we have a background, from where she comes, what socio-cultural background she comes from, if she has any addiction, any educational qualification and background. Like in this case, she is a paramedical person who looks into child education, specifically into special child education, where a lot of health component is involved. She is working in close connection with pediatrician, neuropediatricians, neuropsychiatrists. Her job is very, it looks very painstakingly tedious. Her family background: her father is businessman, mother is housewife, brother who stays in USA, and husband who is also working in a company in corporate world. On the 15th February morning, she woke up with a headache. I thought it could be due to sleeping late and drinking wine. Friend, when you are reading this, some of you might have noted that she writes 15th February. The very next day of 14th February. What is 14th February? Valentine's Day. A young female wakes up next morning of Valentine's Day. Please note this part. On 15th February, she wakes up with headache. She took Advil, she took various painkillers. It is slightly better. Then she goes to primary care physician if she was not better, and generally people do that. First thing is solve through your own ways. You have handy painkillers, you take it. Now she goes to primary physician, and he told her that she is probably suffering from migraine, and this could be one of the first episode. He gave her some medicine which was deeper than painkiller. However, pain did not go away. Pain went on becoming worse, and along with that she started developing pain in both eyeball. Please document the travel of the disease. Patient has developed once again more deeper problem, and physician thinks it is migraine. So everyone defines problem to the level of knowledge they have, the skill they have. There is a lot of heaviness behind the eyeball. There was a lot of nodding in neck, and when she woke up in morning, it was almost unbearable. So she went to nearby hospital. You see, from OPD to now hospital. While waiting for her turn, her eyeball turned red. So you can understand acuity of the situation, and she became extremely heavy. All this is very important for homeopath to note down that how the progress of this headache is taking place. The doctor defines that this is a sinus problem, and they put her on antibiotic. Now painkiller, the second layer, antibiotic. Earlier they thought it is functional headache. Now they think there is infective process which is responsible. She took for 5 days and only 10% better. Now she went to another doctor. This doctor had little more wisdom, so he subjects her to various tests before labeling her disease. She has undergone various battery of tests from blood tests to various other type of testing which is required. And not only that, she was subjected to MRI just to find out why she has headache, and it is better to do that. In last few months, she says, I am very, very unhappy with my life situation. I want to get better. I want to be positive. I don't want to think of my problem. And she says a special plea to the doctors that most of the doctor, when all this process starts, everyone starts pointing finger to you and says that it is because of your mind, it is because of your stress. This is how ultimately everyone points patient in a square and says, you have to change, you have to improve, you have to remove your stress. And then she is saying that who doesn't have stress in life? But do all suffer from like this? And she says, I'm really tired of explaining people about that who will not have stress in life, and why are you pointing me that I have to change when I am very, very happy otherwise? She says, I'm very lucky. People around me are very supportive. Then people are having theory that I am not pregnant, that's why I am getting into this stress. But she very clearly says, I want to be pregnant when I am healthy, not when I am unhealthy. That is not an issue. But friend, as a homeopath, we will keep note of this. I'll talk to you about this aspect. And then she says, I am frustrated of people labeling my physical pain as anxiety and various other aspects of stress. I please want to be normal. What is dilemma of patient and physician? We have seen the journey of patient written by herself. We have yet not inquired. She is telling us a story of her travel. What is she searching for? Relief from her suffering. And what are physicians searching for? At finding out the core of the problem. And ultimately everyone is searching for solution. Friends, all this is possible only if we are going beyond the symptoms and trying to understand that symptoms are tips of iceberg.